My name is Khalil.
Admittedly.
Good evening, everyone. Thank you so much for coming to our 5th week in our summer lecture series presented by RRIPG. I'd like to welcome specifically Dr. Lopez currently. Thank you for attending. We're going to have 3 speakers tonight. Professor Simon Roberts, also known as Dr. Roberts, is going to be speaking later tonight, but first we're going to start off with one of our high school interns. Her name is Miss Ruth Ogbemudia. She's from Valley Stream North High School. So Ruth, could you please share your screen?
Yes, thank you.
So are you in the game?
Okay. Thank you for that introduction. My name is Ruth, or Osaiyekemwen Ruth and I'll be presenting the epidemiology of ankle injuries in professional rugby union players. So overall, this study aimed to describe the epidemiology and to assess the risk factors associated with ankle injuries sustained by rugby union players at the professional level. Overall, this is important because ankle injuries, believe it or not, represent a considerable proportion of injuries that are sustained by professional rugby union players. However, despite this, there is a lack of detailed epidemiological studies about these injuries. Overall, the researchers accomplished this by an injury assessment method in which they had medical personnel report time-loss injuries in professional rugby union players in specifically England, and they specifically evaluated the ankle injuries. So the literature definitely corroborates the claim that ankle injuries do represent a considerable proportion of injuries, but despite there being a large agreement as shown in the slide by, for example, Fong et al. And Brooks et al., there is not a lot of detailed studies that really get into the crux of the intrinsic and extrinsic factors that actually cause it and the actual more specific incidence rates. So as I said before, they used an injury assessment method in which they ensured the correct diagnosis of ankle injuries through, for example, clinical examination, radiographs, and ultrasounds and MRIs. And they also gleaned data and information from a standard injury form. And they analyzed this data with incidence rates and injury severities, and they further statistically analyzed it through 95% confident intervals and chi-square tests to identify significant differences between the values. It's also important they note that they use the OSIS classification system in which guaranteed the correct classification of ankle injuries. Overall, the study found that of ankle injuries between forwards and backs, that forwards had more exposure, especially during training. In regards to severity, a similar trend emerged as forwards have a higher severity. Also, training severity is generally higher in matches. Also, it's also important to note that incidence was lower in training and more similar between forwards. So between forwards and backs in training, they were the incidence was mostly similar during during matches, but it was higher in training. So this is a table I clipped out, and overall it shows that ankle lateral ligament injuries are the most common, but it's also important to note that Achilles tendon ruptures and generally Achilles tendon injuries had the most severity or days absent. And as we go into discussions, the author reasoned this to be because of sudden changes in training patterns. That's a possible explanation for it, or repeated explosive forces towards the area as well. Overall, other points that the author had during the discussion to justify the findings were that second row forwards were most likely subject to injuries as they had the highest rate of ankle injuries. And the author justified this or thought or reasoned it to be because of lineouts in which the athletes jump and land from a height, and that definitely could cause more strain in the ankle region. And this was further corroborated with other literature in soccer, which shows that landing at higher heights is definitely causes ankle injuries. Overall, the other parts of the study, such as incidence and severity, in regards to other rugby union studies that include assessments of the ankle, it was mainly the same and within a range. And this all led to the conclusion that lateral ankle ligament injuries and Achilles tendon injuries should be the major focus of injury prevention when analyzing ankle injuries. And that's it. Are there any questions?
Thank you, Ruth, so much for that wonderful presentation. Congratulations, that was a job well done. Now I'd like to open the floor for discussion. Dr. Lopez, do you have any points of discussion?
Yes, thank you, Ruth. That was very well done. If we go back, the jumping concern is very common. Obviously, the second rows or the forwards that are lifters, they're dropping these players down. Sometimes they come down unsteady due to the fact that they are trying to reach out for the ball out of the line out or into the channel. And we can discuss that at another time. But basketball players are also found to have these ankle injuries because of the landing in the key when they're jumping up and jumping down. So it's a very common concern in sports, ankle injuries. So that's why we're probably moving in that direction. But again, very nicely done. If you go back 2 slides one more time.
Oh, is this it?
Yeah, back one more.
Okay, here?
Yeah, no, this is very nicely done. See, as I was saying to everyone, try to clearly describe your population, definitions, this is your methodology in 1 page, and you want to kind of keep it concise. Again, you don't have to do number of injuries per 1,000 player hours. You could just do 1,000 player hours, exposure, match, or training. You get what I mean? Try to remove the amount of verbiage from there so the slide isn't so busy. But otherwise, very nicely done.
Thank you.
And if you go to your second slide after this, where you have the boxes, no, not this one. You should probably have them fly down or fly in. This way you can discuss them. But I think you only had that issue when you discussed the results or findings, which was fine.
Okay.
Nicely done.
Thank you. Do you guys want me to stop sharing my screen now?
Yeah, I'm going to share my screen now.
Okay.
Should let me.
Okay. Thank you.
Thank you for that presentation. Our next speaker is Miss Dimpie Shah. Dimpie is a medical student at Rutgers Robert Wood Johnson Medical School, and today she will be presenting on the relationships between rugby players' tackling training attitudes and behavior and their match tackle attitudes and behavior. Dimpie, if you could please share your screen.
Hi, everyone. My name's Dimpie. I'm a second-year medical student at Rutgers Robert Wood Johnson. Today, I'll be presenting the relationships between rugby players' tackle training attitudes and behavior and their match tackle attitudes and behavior. This was a paper published in the BMJ Sport and Exercise Medicine Journal, and the primary author was Dr. Hendricks. The primary objective of this paper was to study and investigate the relationship between rugby players' attitudes and their behavior regarding tackling when they're training and when they're playing in a match. The researchers in the study wanted to see if the behavior and attitudes when players were training differed from when they were playing in a match, to see if they were more aggressive or if there are any differences. So some background information before we delve into the methodology and the results. Some important definitions that the researchers used were attitude and behavior. Attitude was defined as the knowledge and beliefs of a person concerning the specific consequences of a certain form of behavior. However, behavior was defined as as two definitions. It was either considered a planned with intention to perform a specific action, or it was considered unconscious and automated. This study was very important because there was little to no literature based on the relationship between training and real play behaviors and attitudes. This is a psychosocial study based on how players train and how they act during matches. It was important to consider tackle injuries specifically because tackle injuries account for 61% of all injuries. That's why the researchers only focused on the tackling and what the mindset was of the players while they were tackling during practice and during real play. By surveying the attitudes and behavior of these players, the researchers found that they could implement specific safety protocols or enhance safety to prevent injury. The methodology for this paper was quite different from the basic science papers that we've always seen. Instead, it was more of a psychosocial approach. They used a survey analysis. Basically, the researchers used a questionnaire that assessed the attitude and behavior of the players, and it was based on a 5-point Likert scale. Likert scale basically means that, for example, 1 could mean not interested at all, and 5 would be most interested. So it's a 5-point scale where players choose between not likely at all and most likely of how they feel about a specific items that's being questioned. Overall, there were a total of 16 questions on the questionnaire with 161 items addressed. Most items were related to training, while the other approximately 1/3 of the items and 1/4 of the questions were related to matches. The population that was targeted was the under 19 junior South African rugby players. Finally, they had a total of 10 teams where they handed out surveys. Although surveys were handed out to every player, there was only 75% return of completed surveys. A chi-square and a Kramer's V-test analysis was used to analyze the data they received from the surveys. This is an example of the survey data, but we're not going to be discussing any of the numbers right now. I just want you to emphasize the point on the different types of categories that were emphasized. For example, specifically, there's a major category, identifying a problem in your tackle technique, and then there's specific subcategories that players rated on a Likert scale. So similar to this, as stated before, there are 161 items. The results. The researchers found that there is a major association for quote unquote what is doing what is practiced. So this basically means that players were in the mindset, had the same attitudes and behaviors during practice that they did when they were playing in a match. There were 4 specific categories that the researchers found were significant. One of them was proper technique for injury prevention. So players were taught during training to tackle in a way that prevented injury. Players were also emphasized their own safety to ensure that they themselves did not incur injury while tackling. Putting in a big hit for players was also an important category that was analyzed. So while players were tackling, they wanted to know and they wanted to feel that they were giving a big hit. And then finally, preventing the ball carrier from retaining possession. This means when a tackler is tackling, they want to either steal the ball from the opposition or tackle in a way where the opposition loses the ball. These were the 4 major categories that were targeted. And then something interesting that the researchers found is that there was a major strong correlation between injury prevention and preventing the ball carrier from retaining possession. So this goes to show that players, even though they're thinking about stealing the ball from the opposite team, they are still thinking about injury prevention during both practice and match play. And then one final thing the researchers found is that front tackles, which are most practiced during training and practices, those were the tackles that were most used during matches. So this was also another association that whatever tackling technique, whether it's front tackle or side tackle that players are practicing, they will be practicing it during a real match and be implementing it more. And then one final important result they found was that the researchers also surveyed how coaching methods play a role in tackling in both practices and matches. And it found that coaching methods play an important role in attitudes and behaviors for training, which are executed in matches. And this could be many categories, which we will discuss in the next table. But overall, training attitudes and behaviors do transfer to match attitudes and behavior. There was a positive correlation. This is the table that the researchers used regarding the association between coaching methods and match attitudes and behaviors. And as you can see, there were different categories from coaching, from one-to-one verbal instruction to verbal instruction to the entire team, to even the coach demonstrating how to perform a tackle and demonstrating to the team. So no matter in what environment where the coach is present, that did affect attitude and behavior. So some practical implications about the study. First and foremost, this was the first study to analyze the relationship between player training in both match and practice regarding the attitudes and behaviors for tackling in the rugby union. Before, there were no papers published. Additionally, this study did show that players do associate proper technique and training while denying possession of the ball in the opposing team. So while they do emphasize injury prevention and having the proper technique to tackle, players are also thinking about how to steal the ball from the opposing team. Coaching methods, whether verbal or even the social environment in which players are being trained, they do account for training attitudes and behaviors. And finally, the different tackle types practiced, the more they are practiced, the more they are implemented in match play. And this goes specifically to the different types of tackles, including side tackles and frontal tackles. Finally, the limitations of the study. I found that the population specifically was a limitation because the study only accounts, although they did have a large sample size for a survey, which was 160 players, it was still relatively small compared to the international rugby players. And specifically, this was for rugby under 19. So a bigger population study, including the Olympic and older players and then international level, should be accounted for as well, because not all teams practice the same way and not all attitudes and behaviors can be categorized for all rugby players. Additionally, this was only in South Africa. So of course we have rugby presence in North America and other countries as well. Additionally, a questionnaire will always be a limitation in such a study. First of all, some questions could be ambiguous. While the researchers have one intent, players could see the questions as something else. They could interpret it in different ways. The questions were also self-reported. So although we want to agree that the players were honest, self-reported the way the players might have done it in a group, they would have done it in a coaching setting. As you can see the other bullet points underneath, the environment was not stable or the same for each player. Some questionnaires were done together as a team with coaches involved, and while others were done in front of researchers. So the environment varied for completion of the questionnaire. And finally, the questions and definitions were provided in a limited scope and means of they were provided from the researcher's point of view, and not all of this was explained well to the players in terms that everyone can have a different perspective. And these are, I only use the paper as a reference, but that's the end of my presentation. Thank you.
Thank you, Dimpie, for that excellent presentation. Now we can continue into discussion. Dr. Lopez, do you have any comments or information that you'd like to add?
No, I thought she did a great job, especially in the limitations. When you're using these surveys, and we've done them ourselves, they are limiting. When you're asking, sometimes you try by giving them the Likert scale to guarantee that you're going to get a guaranteed answer, but then if you look at the evaluation of the results, the answers don't always really follow through with your theories on what you were envisioning the study to reveal. And that's always the unique thing about these surveys. Again, also the questions, due to the varying regions and again, how they use these populations in South Africa, New Zealand, they're usually using club studies. Meanwhile, our players come from all backgrounds. So they have a very unique populace, a small group that they can definitely study, or even a survey multiple clubs within a region. So that's you know, positive, but it's also a limitation because of the lack of variability within your answers or the resultants. You know, the answers or the results in your answers that should be having a larger population to be pulled from to give you a better base. Anyway, very nicely done. Very nicely done.